Good day everyone, I am Princess May Madalo from BS1A. So today I'll be demonstrating a vital signs, which are include the temperature, pulse, respiration, and the blood pressure. So first, let's define the vital sign, which is a procedure that provides data that reflect the status of several body systems that includes cardiovascular, neurologic, peripheral vascular, and the respiratory systems. The sign of basic physiology is reflected in body temperature, pulse, respiration, and the blood pressure. Measures temperature first, followed by pulse, respirations, blood pressure, and the oxygen saturation. So the purpose of this is to assess the client's condition, to determine the baseline values for future comparisons, to detect changes and abnormalities in the condition of the heart. So we need to take the vital signs. So first is upon admission as ordered, any change in status with chest pain or any abnormal sensation, before and after administration of preoperative medications, after surgery or invasive diagnostic procedures, before and after administration of blood products or medications that can cause cardiovascular and respiratory changes, and lastly, before and after any nursing intervention that can affect the cardiovascular or respiratory system. So the materials or equipment that we are going to use is thermometer, tympanic thermometer, digital, oral, auxiliary, and or rectal thermometers. So the second is stethoscope, sphygmomanometer with appropriate cuff size, watch with second hand, pulse oximeter, swab or cotton ball soak with alcohol, sponge towel, paper bag, record or form sheet, ballpoint pen, and the color is black, blue, and red, tray to set all equipment needed, and lastly, toilet paper. Measuring temperature or temperature taking. So the definition of this is a process of measuring or monitoring the patient's body temperature using a clinical thermometer. It may be taken through the axilla, orally, or through the tympanic membrane. So the normal auxiliary temperature range is 35.4 to 37.0 degrees Celsius. The normal oral temperature is 35.9 to 37.5 degrees Celsius. And lastly, the normal tympanic temperature range is 36.7 to 38.3 degrees Celsius. So the temperature below 36.7 degrees Celsius represent the hypothermia and can be a result of prolonged exposure to cold, hypoglycemia, hypothyroidism, starvation, neurologic dysfunction, or shock. So the temperature above 38.3 degrees Celsius represent hyperthermia and can indicate bacterial, viral, or fungal infections and inflammatory process, malignancies, trauma, or various blood, endocrine, and immune disorders. So the purpose of this is to determine body temperature, to assess and diagnosis, to evaluate patients' recovery from illness, to determine if immediate measures should be implemented to reduce dangerously elevated body temperature or conserve body heat when body temperature is dangerously low. And lastly, to evaluate patients' response once heat conserving or heat reducing measures have been implemented. For the assessment, assess client skin if warm to touch. Assess for most appropriate site to check the temperature. For planning, wash your hands to prevent the transmission of microorganisms. And gather all the equipment needed. Good morning, Mom. I am Princess May Madalo, your student nurse for today.
Good morning, nurse.
Okay, Mom, I have a few questions. Is that okay with you?
Yes, nurse.
Okay, so may I know your full name?
I'm Camille Dumpa.
Okay, so how old are you?
I am 21 years old.
Okay, ma'am, do you have any occupation?
As of now, no. I'm still a student.
Okay. So, ma'am, have you been hospitalized before?
No.
Okay, ma'am. So, I'm going to check your temperature in your auxiliary. So, using the thermometer, is that okay with you, ma'am?
Yes, ma'am.
Okay. For evaluation, evaluate the temperature taken. And for the documentation, record the temperature taken and affix signature on the chart, and report any abnormal reading to the senior staff. the second is the pulse rate, is a measurement of the heart rate or the number of times the heart beats per minute. As the heart pushes blood through the arteries expand and contract with the flow of the blood. So the purpose of this is to determine number of heartbeats occurring per minute or rate, to gather information about heart rhythm and pattern of beats, to evaluate strength of pulse, to assess heart's ability to deliver blood to distant areas of the body, to assess response of heart to cardiac medications, activity, blood volume, and the gas exchange, and lastly, to assess vascular status of limbs. So the materials or equipment that we are going to use is only watch with second hand. So there are different sites in taking pulse rate. So the first is radial. So it is the readily accessible and routinely used. The next is temporal. It is used when radial pulse is not accessible. And then the carotid, used for infants in case of cardiac arrest and to determine the circulation to the brain. Apical, routinely used in infants and children up to 3 years of age, used to determine the discrepancies with radial pulse and used in conjunction with some medication. Brachial, used to measure blood pressure, used for cardiac arrest for infants. Femoral, used in cases of cardiac arrest for infants and children, determine circulation in the leg. Pleural, used to determine the circulation in the lower leg and the leg blood pressure. And the postural tibial, used to determine the circulation into the foot. And lastly, the pedal, used to determine circulation in the foot.
For the assessment, assess client's condition and check the nature of pulse. For planning, wash your hands to prevent the transmission of microorganisms.
Mom, I'm going to check your pulse rate. Is that okay with you, Mom?
Yes, nurse.
Okay.
For evaluation, evaluate the nature of pulse. For documentation, record the result of rhythm and force in patient's chart.
So the next is the respiration. So the definition of this is the number of breath per minute, or more formally, the number of movements indicative of inspiration and expiration per unit time. In the practice, the respiratory rate is usually determined by counting the number of times the chest rises for pulse per minute. The aim of measuring respiratory rate is to determine whether the respiratory are normal, abnormally fast, abnormally slow, or non-existent. So the normal range is below 6 months, 30 to 60 bpm, 6 to 12 months, 24 to 30 bpm, 5 years, 20 to 30 bpm, 6 to 12 years, 12 to 20 bpm, and lastly the 12 years to adult, 12 to 20 bpm. So the purpose of this is to provide valuable information about the client's physical and emotional health. And the equipment that we are going to use is only watch with a second hand. So Mom, I'm going to check your respiration. Is that okay with you, Mom?
Yes, nurse.
Okay.
For the evaluation, evaluate the character of respiration. And for the documentation, record the character and the depth of the respiration.
So lastly that we are going to demonstrate is the blood pressure taking. So the definition of this is the pressure exerted on the wall of the arteries when the left ventricle of the heart pushes blood into the aorta. So the purpose of this is to determine the vascular resistance to blood flow, to determine the effectiveness of cardiac muscle in pumping blood to overcome the vascular resistance, and the materials or equipment that we are going to use or blood pressure apparatus, sphygmomanometer, stethoscope, paper and pen, cotton ball soaked with alcohol. Okay, Mom, I'm going to check your blood pressure. Is that okay with you, Mom?
Yes, nurse.
Okay.
For planning, wash your hands to prevent the transmission of microorganisms and gather all the equipment needed. For the evaluation, evaluate the nature of the blood pressure and evaluate the client condition. For the documentation, record the result taken.